Hi, I'm Annie with Forest of Arden Healing Arts. In this video, I'm going to show you some basic moves that you can do to drain stuck lymph from your lymph nodes and to support your overall lymphatic system and your immune system. Normally, you would go to a trained lymph drainage practitioner to get this done. But now, during the COVID-19 pandemic and consequent lockdown, we are not allowed to visit bodywork practitioners. So we have to do it ourselves. We must develop the necessary self-care tools for any eventualities in the future where you don't have access to a practitioner. Also, I want to make clear that this video is not a replacement for care from a physician, and that if you have any lymphatic, circulatory, immune problems, or undiagnosed or suspicious lumps, you should consult your physician before doing any of this work. Lymph nodes are immune structures which receive lymph from lymphatic vessels. Lymph fluid nearly always passes through a lymph node before entering the venous return system. Lymph nodes play a vital role in the immune system. They are one of the sites of the battle between the body's immune system and pathogens. In the lymph nodes, immune fighter cells gain experience fighting specific pathogens. It is in this manner that our acquired immunity is developed. The body contains thousands of lymph nodes, which are kidney-shaped organs made of lymphoid tissue. Inside each node, there is a network of reticular fibers grouped into follicles. Here, lymphocytes, such as T cells, B cells, natural killer cells, and macrophages do their work. Antibodies are also produced here and then travel through the lymph to the bloodstream for distribution. Lymph nodes feel bigger and harder to the touch when they have a battle raging in them, because inflammation ensures that all the necessary fighter cells have arrived to the battlefield. Nodes are distributed throughout the body, either singly or in closely connected chains. For example, there are chains of lymph nodes in the groin. These are called the inguinal nodes. There are also prominent chains of lymph nodes in the axilla, the neck, the breast tissue, in men and women, and smaller chains in joints, such as the back of the knee and the elbow. Lymph nodes are also present at branches of the lymphatic vessels. There are many nodes in the abdominal and pelvic cavity where large lymph vessels pass through. Lymph nodes also protect the skin and mucosal surfaces of the respiratory, digestive, and genitourinary tracts. Now I'm going to show you how to drain your axillary, mammary, and inguinal lymph nodes. To do these techniques, you will need to have watched our video called Self-Lymph drainage, because you need to drain the large vessels before you drain the nodes. If you have already watched and practiced draining the angulus venosus, the cisterna chyli, and the deep chain, then let's proceed now to the lymph nodes. If you haven't seen or practiced the work on that video, click the link shown here and go do that. Then come back to this video. What to wear? Nothing. You will need access to your bare skin at your axilla, side of breast on both men and women, abdomen, and groin. Because of rules about bare bits online and the inappropriateness of showing our skin, I will show you on me clothed, and we will also use drawings. If you have any questions about specifics, you can email us. Lymph flow feels like a subtle receding tide, pulling you with it as it flows. So as you place your hands on the skin and sink down into the skin, you want to listen and try to feel that tidal wave. And then once it starts to pull you with it, you follow that tide in. At the end of that tidal movement, impart a subtle push in the desired direction, and then return back to neutral and feel for it again. You will repeat this about 5 times. I want to show you how gentle and subtle lymph drainage pressure is. So for this example, I'm going to move the lymph in this direction. However, it's going to look very like a very small amount of movement. So you simply contact the skin and feel the lymph just under the skin. And then once you connect to the lymph, again, like I said, I'm dragging in this direction. With the finger pads, not the fingertips, with the finger pads, I'm dragging my skin in the direction that I want to move the lymph. And then I take it to the end of drag until I lose connection with the skin, and then I return back. And then again, connect to the lymph and drag the skin. I say I'm dragging the skin, but I am moving the lymph because the lymph is just under the skin. And then return. And one more time. So you can see as I move with the lymph and then return, it ends up being like a wave movement. Here's the order of the moves. For the upper body, first, drain the angulus venosus. You always need to start every lymph drainage session by draining the angulus venosus. This is the last return back into the circulatory system for the lymph system. Now I cover draining into the angulus venosus in this other video. After draining angulus venosus, drain the axillary nodes. Then drain the mammary nodes. For the lower body, if you don't do the upper body, make sure to drain the angulus venosus first. Then drain cisterna chyli, and then drain the deep lymphatic chain, position 1 and 2. These I have also covered in the previous video. Then drain the external iliac nodes. Then drain the first line of the inguinal nodes. Once you finish the inguinal nodes, then you want to rinse. So you want to reverse the order of the draining trunks. So first do deep chain position 2 at the pelvis, and then 1 around the solar plexus, and then drain from cisterna chyli, and then return at angulus venosus. To drain the axillary nodes, reach across your body and place your hand in your armpit, with the arm you are treating down on your side. You can prop up the arm you are treating with a short block or a folded towel or blanket. Once your hand is in your armpit, you want to find the apex or the deepest part of the armpit and press in gently to find the movement of the lymph in the nodes. Notice if it feels full, stuck, hard, or warm. Then using very light pressure with the finger pads, not the fingertips, encourage the flow from the nodes toward the mid-clavicle area. After you feel the flow stop, pause, and let the lymph flow return back to neutral and come back and repeat the encouragement toward the clavicle. You can do this flushing movement 5 times. Next, you'll work the mammary nodes. In the same position as the axilla nodes, bring your hand lower along your side to find the mammary nodes just posterior to the lateral border of the pectoralis major. Once here, you will drain superiorly towards the axillary nodes. Now you could stop there if you just wanted to drain the lymph nodes in this upper torso area. If you want to drain the lower body lymph, then carry on with the instructions. To begin to work the lower body, you want to first deepen your breath and take 5 to 10 deep belly breaths. This will begin to encourage the flow of the deep lymphatic chain, including the lymph nodes and vessels, and will encourage a freer flow up towards the heart. Then, drain the cisterna chyli. Refer back to the video we linked to here to do this move. And then do the deep vascular chain in 2 positions, also in that video. The 2 positions being at the solar plexus first, and then both hands along the dish of the pelvic bones. Next, we're going to drain the external iliac nodes. Use both hands to create a line of your fingertips like this, and find the area between your hip bone and your pubic bone. There will be a groove here where you will find the external iliac nodes. Find the area between your hip bone and your pubic bone. There will be a little groove here where you will find the external iliac nodes. Use your finger pads, not the fingertips, to encourage the lymph superior and medial toward the heart. Again, you will make gentle wave-like movements following the wave motions of the lymph, and you can repeat this about 5 times. Now, with the same hand formation, with both hands, you're going to move below the inguinal ligament to find the first line of the inguinal nodes, just at the crease of the joint, where the leg creases when you sit. Combining 2 moves into one, you will drain these nodes in a slightly lateral and superior movement. And then these nodes you will drain medial and superior, so that the move will have a funnel shape, draining the fluid towards the external iliac nodes that you just drained before. As with the other locations, you will follow the lymph movement, that tidal wave, until the end, release it, and then return back to neutral. And as with the other locations, you can repeat this about 5 times. Then you're going to rinse the previously worked areas. So you're going to rinse the external nodes, and then rinse the deep abdominal chain at the 2 pelvic bones, and then the one at the solar plexus. Then rinse cisterna chyli, and then to end it all off, you're going to rinse at angulus venosus. If you have any questions, you can email us or leave us a comment here on YouTube.